cervical radiculopathy or a pinched nerve. If you have this, then I'm going to show you today 3 different things that you can do to check if you have cervical radiculopathy, as well as 3 things that you can do at home today to get out of pain. So what is cervical radiculopathy? Well, essentially a lot of people like to call it a pinched nerve, and really what it comes from is when you look at your neck, you look at the structures of your neck, the structure of your spine right here, you can see all the disc spaces separating the bones, but really the job here is that it's protecting these nerves. And so there's a few reasons why people get this, and it could be trauma, it could be accidents, things like that. It could be bone spurs, so the actual bones in the joints are actually changing, they're growing. It could be degeneration, so arthritic type of changes over time, and generally because of that, and we do see that a lot, it is generally an older person's issue. But realistically, it could be disc herniation. So this could happen at any age. It could happen for various reasons. It could be like things like stenosis, or even as simple as a muscle spasm in your neck. Any changes to the actual spine and where this pushes in or the bones start to collapse on the disc, well, that's going to cause that disc herniation, and that can push into the spine. It can push into the canal, but it's inflammation. So how do you know if you have a pinched nerve or cervical radiculopathy? There's a few things that you can try right now. The first thing I want you to do is see if you can bend your chin to your chest. Just bring your chin all the way down to your chest, and then can you bring yourself all the way back up? If you are getting an increase in the symptoms, you're getting not only pain in the neck, but now it's actually traveling down your arm, then that could be a sign that you've irritated the nerve. So that would be a check mark right there. By turning your head left or right, side bending or inability to side bend your head. If you can't do regular range of motion, then that is a strike. That does tell us that there's probably an issue there. But the other sign I want you to look out for is whether or not you're getting shooting pains or numbness, tingling that's traveling in your arm. So it could be either side, and if it's traveling down both arms, then you're having a pretty serious issue here. But it could be traveling all the way down to your hand, so it could be like a carpal tunnel type of issue as well. You could be feeling it in just these fingers, these 3 fingers, or the whole hand, the back of the hand, or even worse signs that I want you to look out for is muscle wasting. You're noticing the muscle in your arm is becoming more atrophied. It's becoming weaker. You're having problems grabbing things. You're having problems holding on to things. If you're getting it into your hand, I want you to see if you're able to make a fist. Are you able to get nice and tight, or is that even difficult to do? Are you able to do the OK sign, or is it falling, collapsing like this? You're not able to go tip. So that's a really bad sign if you can't do that. Or go to the other fingers. So these are tests that you could try right now to see whether or not you have that, especially if it's going into your arm. For some people, it will come and go. It'll be gradual, or sometimes it'll come instantly. You had a fall or an accident or something like that, or it's getting worse. So if this is a concern to you, then you need to get this checked. Either go to your family physician, go ask for imaging. You're going to need to do some type of investigation in order to know what is causing the issue, because it's not just muscle, it's not just something that can go away. However, studies have shown that most of the time it doesn't need intervention as far as doing a surgery. Most of the people don't need that, but they do need some type of intervention, whether it's physical therapy, chiropractic, osteopathy, massage therapy, physiotherapy. There's so many different types of things. Now the difference here being the precision when it comes to your care. When it comes to chiropractic, I'm a chiropractor, so what we do is we analyze the spine, we'll take x-rays, and we'll see what is causing it, and then our game plan is always going to be to correct the problem. What caused this in the first place? The most common thing that I see that causes cervical radiculopathy is when one of the bones inside your neck stops moving, or it becomes degenerated because the shape of your spine has changed. And so if we can change either of those, either get range of motion back, movement back into the spine, or we can actually change the shape of your spine, then what we're doing is we're actually undoing the original cause of it, and therefore we're preventing any future issues. Here's 3 things I want you to do at home in order to get out of pain today. Now the first one is going to be quite easy, and it's going to be range of motion. Again, this is the most common thing that I find here in the practice. And so what I want you to do at home is just work on your basic ranges of motion. So you will turn your head to the right, then turn your head to the left. And you're going to repeat that 10 times. And then you're going to bring your chin to your chest, and then you're going to look all the way up. And again, chin to your chest, all the way up. Now you have to be careful with this, because when you're doing these exercises, you're starting to change things. If you get a momentary flare in symptoms, that's not necessarily a problem. But if you're getting a long, persistent pain after you do this, then again, I would definitely make sure you go talk to your family physician or get yourself under a chiropractic care. And the last one I want you to do is going to be tilts. So you're going to tilt your head to the side and tilt your head to the side. Try not to bring up your shoulder when you do this one. You want it to be as pure as possible, because you really want to stretch out the side. Now, if you're noticing that the pain is, let's say, on the right side, and you want to help that, you're getting the radiation down there, then if you're having a hard time coming this way, but it's not causing more pain, then what I want you to do is just overpressure a little bit with your hand. You're stretching out the side perfectly, but as you overstretch like this, you're going to start to release the nerve, release whatever is holding you back. And as we release that, you're going to be able to get a greater range of motion. You're going to feel a lot better in your neck, but more importantly, you're going to start to notice that the pain in the hand starts to go away. This is something that, if you're not new to this page, that you've seen me do for quite a few other things. This is a go-to for so many types of issues in your spine. So you're going to bring yourself back, and essentially what you're doing is you're giving yourself a double chin. So you're going to bring yourself back, you're going to hold that for 3 to 5 seconds, and then you're going to let go. Again, it's pulling yourself back and then letting go. Now the point of this is that when you're bringing yourself back, you're flattening out your back, but what we're doing is we're opening up the joints. And more importantly, what's happening is we're working on something called the deep neck flexor, which, if used properly, if this is a muscle that becomes strong again, then it is something that's going to help support you and prevent even future issues. So bring yourself back, you're going to hold for a couple seconds and let go. And just repeat that 10 times to start loosening things up. You really shouldn't see too much pain with that. You just might feel a little bit of discomfort as far as where the problem might be in the neck. Now this last exercise, what you're gonna need is you're gonna need a hand towel, or even better, a bath towel. There's a couple stages to do here, but I'm gonna show you 2 different ways to do this. Now the reason why we're doing this is because a lot of the problems, the spine is out of alignment, but also that the neck has lost its curve. The neck should normally be like this. You should have that normal curve, but what happens is it goes like this, and then it puts extra pressure on the discs, on the joints, but on the nerves. And what happens is then you can get the degeneration, you can get the arthritic changes, and it kind of snowballs from there. So a lot of people, this is the actual cause of it. And so what we want to do is we want to actually change that by putting the curve back in. If you take a towel, you'll see I'm just pinching both ends here. And what I'm going to do is I'm going to put it behind my neck. Now when I put this behind my neck, I'm just going through the middle of the neck. That's all I'm looking for. And I'm trying to shoot straight out. So I'm just going to push straight out, and then I'm going to let my head flop back. Don't force your head back. That's not the point of this one. What you want to do is you want to bring your hands forward, and then you're going to let your head fall back. You're just going to hold that for about 10 seconds, and then you can relax, right? At the office, we actually have something like this. This is a pro-lordotic neck exerciser. So you could go as far as buying one of these. These are actually designed to increase the curve at home actively, meaning you're doing some exercise here. And this one you're going to see, if I go back here, you're going to see you can actually really get a good range when you do this one. So this one's really good this way, and you're really getting that curve, and then you're coming back. So this is something that you can invest in, but realistically, just using a towel is probably going to do the same thing. I would also, as another progression, is I would use another hand towel. I would wrap it into a roll like this, and then I would put just a few elastic bands like I've done here, because then it'll hold it in place. Now what I want you to do is I want you to lay down on this so that passively, meaning you're just letting gravity do the work here. So if you have a lot of pain, if you're a little bit older, you've had a lot, this pain has been there for a long time, then this is a nice, easy way to passively do it without having to work too hard. And we should see a lot less symptoms from this. So what you're gonna do is you're gonna take this and we're gonna place it in the base of your neck. Now, when I say the base of the neck, it's very important that you landmark this. So if you bring your head down, you're gonna feel the bone that sticks out the most. The bone that sticks out the most is your C7. That is the last cervical vertebrae before it becomes your thoracic, your upper back. So what you want to do is you wanna landmark that, and when you're doing is you're placing this in the base. So a lot of the times, as much as we're gonna be working on the neck here, you kind of think of it like a shoulder thing that your neck is gonna go over. So that's the general way to think about that. And what's gonna happen is as you lay down, it's gonna push into your neck. And this is gonna create a relaxation of the neck. It's gonna relax the muscles, relax the nerves, and then you're gonna get a really nice sensation from that. The trick with that one is to do it in stages. So you wanna start with about 1 minute to 2 minutes. See if you can tolerate that. If you're feeling better by doing that, then you're gonna increase that to 5, 6, 7, 10 minutes, all the way up to 15. Research has been really clear around this, that if you use a device like this where you place it in your neck, you're getting that curve. If you get to that 15-minute mark, you're actually changing the ligaments in your spine, which now would actually hold that curve, which is what you want. So get up to 15 minutes, but slowly get to that point. If at any point of doing any of these exercises, you feel worse or that the symptoms are really not improving, then this is your sign. Pick up your phone, call your local chiropractor, get into the office, and get under chiropractic care. It could really be the one thing that helps you. Listen, if this information helped you in any way, please give it a thumbs up. If you want more information like this, health tips and tricks, and what you could do at home so you can live the life you were designed to live, then please subscribe to my page. And if you know anybody who is suffering, share this with them, because we do want to make a bigger impact.